Welcome back to Midwest Access. Well, I am here in the comfy, cozy, beautiful office of Sarah Hancock-Hall, and she is a certified sex therapist. Yes, you heard that right. We are talking to a sex therapist today. Look what a normal person she looks like, right? Well, you know, I just say that to address the fact that sex is uncomfortable to talk about, but it is a part of our lives. I think we can all say yes, that is a part of our lives. It's part of who we are as humans. And so this is what you do, is help people in that area of their life. Mm-hmm. And so, yeah, can you explain like what a sex therapist is and maybe some reasons we might want to see you?
Yes. So a sex therapist really is just like your everyday therapist. But we are trying to treat issues of asexual nature.
Okay.
So that really, there's a range of problems that can show up in a sex therapist's office. So the really common ones tend to be about desire levels in a relationship, or low libido or changes in libido.
That's huge.
Yes.
Yeah.
That is super, super common, and that should really having different levels of desire in a relationship should be seen as the norm, not the exception to the norm.
That's good to know too. I mean, you see it in every sitcom, you know, millions of movies. It's like the common theme that there's this
tonight.
Right.
Yes.
It's such a common theme, and so it's good to know that's normal.
Yes, that is so normal.
Yeah, but it's also something we can talk to a sex therapist about, we can talk to our partner about, and I would think getting on the same page has got to really help out your relationship.
Yes, and it's when we are not on the same page that becomes a problem, and that's when it shows up to my office, where typically what happens is partners feel like they have unmet expectations.
Yeah.
There's resentment. There's potentially obligation sex happening.
Yep.
Doesn't feel good to anybody.
No.
So those are the big things that come out of that different levels of desire that would come to a sex therapist's office, where we would untangle all of that.
Wow. I mean, I'm just thinking of past relationships, of friends of mine, all the things that you talk about all the time.
Yep.
That's a huge one. And if you could come and see somebody, get that taken care of in your relationship, wow.
Yeah.
That's going to be a huge load of stress off of that relationship.
Mm-hmm.
Yeah. Now again, there's a giant variety, I'm sure. Yeah. What's something else, maybe something more serious somebody might come to, as to your comfortability? Is that a word?
Yeah, so there's a lot of different things that sex therapists see and do.
Okay.
So it could be challenges with orgasm or arousal. It could be bigger relationship problems that stem from the sexual issues in the relationship. It could be sexual pain, out of control sexual behavior, sexual trauma, all those things.
That's kind of what came to mind too, was like past sexual trauma, you know, again, thinking of friends and different people that we talk to in our lives, you know, some of that you don't want to deal with, you don't deal with it, and then it affects every relationship after that.
Yes. So sexuality is kind of the final frontier is what I say to people. When folks say, I've already worked on this. Like, why is this showing up in the sexual relationship? And that's what I say is like, this is sort of the area that people are most reluctant to actually address directly.
Okay.
But that's where I come in.
Yeah. To have somebody to help you, like you said, just like a therapist. You know, for me, going to a therapist was really like, okay, how do I communicate? How do I get these feelings and words out?
Yes.
And this is that same thing, but just in a sexual nature.
Yes.
That's awesome.
Yeah.
It's so nice to know that there's resources, and that's one thing that we're all about on Midwest Access is connecting people with resources, with things that are available in the community that you maybe didn't know about, or maybe you were afraid to ask. This is why you're here, and we're here to learn.
Yes.
So, okay. Yes. All right. Welcome back to Midwest Access, and welcome back to our new segment called Asking for a Friend. And we are here with Sarah Hancock-Hall, and she is a certified sex therapist. And we're talking about all the different things that are related to sex and to our bodies, and different things that we can go through in our lives. And the lack of communication, the ignoring it, all of those things make it worse. And that's where you come in.
Yes. Yes.
And so today I wanted to ask for a friend about about pain with sex. A lot of women talk about that. Not even always related to pregnancy and childbirth, but sometimes related to that. Now that I'm nearing the menopause age, I'm hearing a lot of it in relation to that. And so, is that something that we can seek help for, first of all?
Yes, absolutely. So sexual pain is very common, but it is also something that typically women tend to wait a long time before they seek help for that.
Because I think they're embarrassed.
We're embarrassed. We think that there's something wrong with us.
Right.
And it can cause, relationship issues.
Definitely.
Etc. So yes, that is something that is highly, highly treatable.
Okay, well that's good to know too, because I do think we think that in our heads, like, well, I mean, if it's my anatomy, what are we really gonna do?
Yep, what can we do with this? Yeah, or sometimes even women have been to like a primary care physician only to be told, well, your tissues look fine to me, have a glass of wine and relax.
Oh.
That is not helpful advice, because typically there is a problem happening in the muscles in the pelvic floor.
Okay. Mm-hmm. And I suppose maybe like other things, I have a nutrition background, and often people will say, doctors will give advice, but that's not their specialty. So this kind of is making me feel along that vein that isn't that they're trying to give you bad advice, but it's not their specialty.
Yes.
Where it's your specialty.
Yes. Yeah. Yes. And it's not necessarily doctors' fault, because most medical and mental health professionals receive very, very little meaningful training in sexuality. So this is definitely not something that a lot of providers are very familiar with.
Sure.
Yeah.
So they check what they think and then send you on your merry way, but it's not very merry.
Sexual pain is not merry.
No, and I'm thinking of other things we talked about too. Talk about leading to resentment, or leading to just getting this checked off your list so that I don't have to experience this pain, and just what a detriment that could be to your relationship.
Mm-hmm. Yes.
A lot of stress. Life has enough stress on relationships. Let's make the joyful parts joyful.
Yes.
Right?
Yes. So earlier we talked about desire and how two people can have different levels of desire in a relationship. Well, if sex hurts, you are not going to be desiring that. So it is a huge desire killer.
Yeah.
And so whenever folks come to me wanting to work on desire, and then we talk about the pain piece, and they don't even realize how much of a detriment that really is.
Sure.
That pain really comes to the top of the priority list.
Nice.
So that we can start working on that first, because really without working on that first, the other pieces of the puzzle can't fall into the puzzle.
Yeah. Anything that you have, anything time you're having pain, you want to avoid that activity at all. I think of working out too as one where people will complain, I have lower back pain or this, and it just prevents them from at all going to the gym. Well, this is another prime example of that. So there's things that you can do and talk through and figure out what's causing the pain, and then able to improve.
Yes.
Okay.
Absolutely. Yeah. So
I'm like, question mark, hopefully.
yes. There's typically, there's a couple of different pathways that you can travel down if sexual pain is part of what you're experiencing. So on the one pathway, it may be related to the muscles in your pelvic floor.
Okay.
So that would best be helped by a pelvic floor physical therapist.
Oh,
so
wow.
that is a physical therapist who is specialized in the treatment of the muscles in the pelvic floor.
Oh my gosh.
So
I didn't know that was a thing.
It is a thing.
I feel like every woman should have a pelvic floor physical therapist.
Yes, yes. Every person
Yes.
should have all the therapies.
Yes, yes. All I'm thinking of is my 3 9-pound babies, and like, I bet you my pelvic floor is garbage.
Yeah, maybe it was at the time. I hope it's not anymore.
Yeah, I think it's okay, but yeah, it was not. There was definitely it couldn't have been good.
Yeah, I mean, but that's normal
Yeah.
stuff, but yet we don't know how normal that is, and we don't know that there's help out there.
Right.
Yeah.
And that you can treat it, and that you're not the only one.
Yep.
But especially up here, anyway, it seems like we're a little more conservative. We have a little harder time talking about some of those uncomfortable things, and so that's why we're talking about it on Midwest Access, so that you can see this is normal to talk about. And when you think about it, it is something that affects every single person's life. It's really nothing to be embarrassed about. And why not get those issues looked at and healed and move on with some joy in that relationship?
Yes.
Yeah.
Yes. And so you had talked about menopause a little bit
Yes,
earlier.
yes.
So there's
like I said, little birdies have been telling me this is what's coming in menopause world. Like, oh, all right. Well, we got Sarah to help us out.
Yep. We got people in our court.
Yes.
But so a part of what can happen in menopause is with the declining estrogen in our bodies, our genital tissues can actually become kind of dry and fragile.
Okay.
Okay. So
the skin itself
like healthy. The tissues are not, they don't have the level of moisture or like resilience that they do when we have more estrogen flowing in our bodies. And so there is a condition, sorry about this, it's a mouthful, it's called the genitourinary syndrome of menopause. Okay. But essentially that can be treated with estrogen.
Oh, wow. Okay. And so again, not your fault.
No.
This is part of life.
You are not broken. Yep. None of that stuff.
No.
Yep. This is normal. Women's health matters.
Yes.
And there are medical doctors, physical therapists, sex therapists that are very well versed in how to help women with these issues.
We just need to speak up and know that it's okay that we're having these issues. It's okay that women in their 50s and 60s and 70s and 80s and 90s are having sex.
Yes.
That's okay. That's good, actually.
Yes.
And we just, we're just going to say all the things until we get used to it, and we get used to being able to advocate for ourselves, our own bodies, and how we can be the healthiest we can be.
Absolutely.
Yeah, that's awesome, Sarah. You're amazing. Thank you so much for helping us out with this stuff. Welcome back to Midwest Access. So we are doing our new favorite segment, Asking for a Friend. So I am your friend that you can ask any of your questions to, and I will bring them to Sarah Hancock-Hall, who is our certified sex therapist right here in Rochester. And so, Sarah, first of all, thank you for being with us today.
Thank you for having me.
Oh, it's a delight. And she's extremely busy, so I appreciate your time very, very much. So asking for a friend today. My friend has a husband who is very, very quiet. She says they love each other, they desire each other, but he is extremely quiet and conservative in the bedroom. And she feels like it is very much becoming a detriment in their relationship, and just getting him to like communicate, to even just like say some of the words is really difficult. And so would they be candidates to come and see you first of all, and then where would we go from there?
Yes, absolutely. That's super, super common. So couples often struggle with communication about sex more than they struggle with the actual act of sex. So
that's so interesting. We were talking before, and you had said it's actually easier for people to do the act than talk about it, which is hilarious but true. So we need to just be able to talk about the thing that we're already doing.
Yes. And sometimes where we start is what feels like the easiest,
Okay.
right? We don't want to start all the way with the thing that feels the most embarrassing,
Sure.
or the
We don't have to jump in the deep end.
we don't have to jump in the deep end, but where can we start? Can we
Okay.
just start with intimacy?
Sure.
How do we feel about intimacy? Oftentimes people find that word much more palatable than
Right.
sex.
Yep.
Right?
Yep.
So is that a better place for us to start? And also exploring how this has developed over time in the
Okay.
relationship. How do you feel about
Okay.
this? Oftentimes, sex therapy really is not as much about the act of sex itself. It's about how you feel about sex
Really?
and its place in the relationship.
That makes a lot of sense.
Yeah.
Yeah. When you think of all the emotions that are tied up, all the expectations, all the
Yes.
different things that are tied up in there. We've joked before about sitcoms, and it becomes the wife obligation, and no one's having fun in that situation. And one of the reasons too that I wanted to speak with you is I think marriages in general just are under a lot of stress.
Yes.
And this is just another area, but it doesn't have to be, because clearly you are in a relationship because you love that person, and what better way to show that than to communicate openly about your relationship. Yeah.
Yep.
With communication, it's so hard if maybe you're the one who's a little bit more bold to be that one to bring the conservative one kind of out of their shell. And I think sometimes it depends how long your relationship's been. It depends on a whole bunch of things, but that person can feel a little intimidated.
Yeah.
And so coming to you seems like a really beneficial thing to do, to have you ask the questions and help facilitate those conversations.
Yeah. And a really common dynamic that can develop is what we call a pursuer-avoider dynamic in a relationship.
Yeah.
So you're talking about a person in the relationship who maybe feels kind of intimidated and kind of like a little bit
uncertain,
like, yes,
afraid.
Yes. Where sometimes the other partner can fall into like a pursuing role where they're saying, let's talk about this, like let's get something going, let's initiate.
Yeah.
And so, but what happens is like we just sort of play this like pushing and pulling that's happening there, where my attempts to get things going only kind of push that more avoidant partner back into their shell.
Yeah.
So that is a very, very common pattern among long-term relationships that I see in my practice.
Yeah, which is, it's too bad. You think of all the things we navigate, whether it's life and careers, children, just everything, that it'd be so nice if we could take this part and not have it be stressful. So that is definitely why we are talking about it today. Is I just really feel strongly that relationships can thrive much better than we often let them, or we often just kind of continue like, oh, this is fine. And it could be so wonderful. And like you said, there's so much. So it really sounds like coming to talk to a sex therapist, you're probably going to be talking about a lot of other things rather than actually the intimacy itself or the physical act. You're going to be getting to the root of why is this so hard to talk about? Why am I not able to share my feelings with you or you with me?
Yep, exactly.
So a lot of what we maybe think of as traditional therapy involved with talking to a sex therapist. A lot of working everything out. Yeah, I agree. We said before, everyone should have all of the therapists. So this is our way of working towards that, to normalize that, to normalize the things that we're all going through that are normal, but we can address and we can live a more enriched life. So thank you so much, Sarah.
Thank you, Jessie. you.